We had COVID-19, which was the first case being registered on 12th of March 2020 here in Machakos. Following that, we were able to set up a COVID-19 hospital. Allowances were allocated for COVID-19 and equipments were bought. Today, as we speak, as healthcare workers, we have never been paid those allowances. And these allowances are cutting across so many other allowances within this department. We have followed and we've done our own research, and it's clear that that money was pocketed by a few people in this government. Some were our directors, some are still in office. We are not happy about this. We have registered today officially our complaints with the ESCC, Ethics and Anti-Corruption Commission, so that they can come in and we want an inventory of all equipments which are being used in that hospital. Last week, we had very well our ICU. There were reports of our ICU being closed. Machines which have been used previously in the COVID-19 hospital were locked up in a store here, while our patients, our relatives and our friends could not access them in our ICU. We are saying this is sabotage of the highest order. The same people have pocketed our allowances. We are not happy about this. During COVID-19, we lost health workers.
Yes.
We lost healthcare workers due to COVID-19. Those monies have never been paid. Our petition is very clear. One, we want a clear inventory of all the equipments which were purchased during COVID-19. All of them. We want a clear list of all monies which are supposed to have been paid to our members. Nurses really suffered. In fact, we bear the brunt of COVID-19.
As in that time, hatujaipata pesa yetu ya COVID-19 allowances. So nauliza pesa wale ambao walipewa tafadhali, we asking for our money because we worked, and some of us really, some of us have died kama hawajapata hiyo pesa. So we are kindly asking wale ambao hizo pesa walipata na wakareceive, kindly pay nurses.